Hi, I'm Dr. Allison Rodgers with Fertility Centers of Illinois. We know it seems like there are a lot of moving parts, so it's important to understand what to expect in terms of timeline. One of the first things you're going to need to do is find an egg donor to help create embryos. And this can be mixed with either one person's sperm, or if there are two people, both people's sperm. And that process can take some time depending on whether you use a fresh or frozen egg. Fresh eggs come from an egg donor. You usually get more eggs, but it can take a little bit of extra time. Typically, I would say on average about 2 to 3 months. For frozen eggs, those are eggs that are already procured, and you just pay the egg bank just like you'd pay a sperm bank, and they ship the eggs. Typically, you get a smaller number of eggs, typically around 6, and it is typically a little bit faster. So the first process is creating embryos. And then of course, the second process is getting the gestational carrier pregnant. If you have someone in your life who's acting as a gestational carrier, the testing can be a couple months. If you're using an agency or using a gestational carrier, they probably will need to do a few tests on their uterus to make sure their uterus is healthy, to make sure they're a good candidate medically and obstetrically. And then also there's going to be legal contracts involved to protect your parental rights. So that process, I definitely encourage you to get started with that as soon as possible also. And that process can usually take around 4 months or so. So you're looking at approximately a 6-month period. Certainly sometimes things go faster and sometimes things go slower.